To discuss this, I'm joined from Harare by Doug Coltart. He's a human rights lawyer and activist. And we also have Nigel Mugamu. He's a journalist and founder of the online news publication 263 Chat. Gentlemen, thanks so much for joining us. Nigel, if I could begin with you, why is it that the nurses seem to have blinked first? Why have they gone back to work and haven't got anything in return?
Look, I think basically government put its foot down and said, look, you lost you've lost your job basically. And obviously the context to this is a day before the Independence Day on the 17th of April. This is when they were fired, and of course, or they went to they went on strike, and then of course they were then fired Independence Day. So they've obviously been reinstated, but obviously conversations have obviously taken place, and government is not in a position to do anything about the situation right now, given that the elections are in a few months from now.
Okay, so Doug, do you agree that the government is not in a position to do anything right now?
If I may just clarify, in a position to do what? I think that I mean.
Okay,
well, maybe
okay, hold on. So Nigel, explain that. I took it as, when you said the government's not in a position to do anything, you mean that the government doesn't quite maybe have the money as well in order to up their salaries and so on. Is that what you meant? Okay.
Yeah, that's what I meant.
Okay, so Doug.
Government doesn't have the salaries.
Okay, so Doug, government can't really do anything right now. Do you agree with that?
I don't agree. I think that really it comes down to misplaced priorities by the government that spends a lot on other things, and we see that lavish spending in the media all the time, and a lack of priority of the nurses. But I think to some extent the real issue here is was the summary dismissal of thousands of nurses by the vice president, who is not their employer, and who has no legal basis to conduct a firing in such a fashion. So I think that was the major reason. That was kind of the driving force behind the outrage, I think, from the general public at what happened. That thousands of workers could be fired by the vice president.
Okay, so Nigel, even if the government had a point and the money is not in the coffers, was that public humiliation of the firing of thousands of nurses done on TV the wrong move by the vice president? And for the president to then endorse that, was that even worse?
Look, yes, I think. Education and health are very, very important to us. So either directly or indirectly. But I certainly don't want to go to the hospital when I'm sick and for a nurse or someone in the medical profession to help me to get better if they're disgruntled. I mean, that's a problem for me, And so the issues around why are they disgruntled need to be fundamentally addressed. I've also said. That look, a lot of the issues that they are dealing with are around their working conditions. I'm not entirely sure what the working conditions are in detail, but I'm sure some of those can be sorted out without incurring any cost.
Right.
So if it means changing shifts or whatever the issues are, I'm sure there's things that can actually be done. But to me, it's less about the embarrassment of people being fired all at the same time, and it's more about why are they being fired. And as a citizen, that concerned me a great deal. How can you just fire a whole profession all at one go? And I think the timing wasn't great. The day before Independence Day on TV. Right. I mean, I think there's another way of handling this kind of situation.
Right. So, Doug, looking at or listening to what some of the nurses were saying, they're saying pay disparities. They're saying we don't get paid enough. They're saying we don't have enough medicines in the hospital. The conditions are not good. The hospitals don't have the right facilities. And the list goes on and on. Given that the vice president did this, responded in such a way that President Mnangagwa supported him and that the government put their foot down, as Nigel says, Is there any indication that the government is going to take any of these grievances, these deeper-rooted grievances, seriously?
Unfortunately, it seems not, and it's important to realize that these are grievances that date back to 2010. These are allowances and full salaries that nurses have not been paid for nearly 10 years. And in addition to that, some of the basic things that they're asking for is a rationalization of the pay structure. Some senior nurses with masters, even PhDs, get paid less than drivers, or just general hands in the hospital due to just a pure sort of administrative mistake, which could very, very easily be rectified.
Okay.
But the strong arm way that government has handled this doesn't seem to demonstrate that they are going to be willing to address those grievances.
Okay, right. Temba Mliswa joins us now. He's an independent member of Zimbabwe's parliament and a former member of the ruling ZANU-PF party. Temba, we have this situation. It's played out in the way it played out. The nurses are back at work, but would you agree that this has been an embarrassing situation for Zimbabwe?
Listen, I think what is important for us is to understand that the nurses play a very integral part in nation building from a health point of view, the same way the teachers do, the same way the civil servants do. So it would certainly not be a welcome development to see them striking. And I think intervention is needed from the highest office in the country. And I think this is why the Vice President Chiwenga was involved, because it then seeks that attention. And for me, they've worked hard for the country. They've been patriotic, they've been nationalist. And I speak from a background that my mother is a nurse of over 40 years. So I am aware of what nurses go through and what they do. You cannot ask for a better serving people than civil servants in this country, nurses in particular. And it's only good and fair that they are remunerated fairly.
But they're not being remunerated fairly. As an MP, how do you feel about that?
It's an issue which the Minister of Finance needs to deal with. I think it's pretty clear that a lot of money is lost through corrupt activities in government, and the Auditor General, Mrs. Chari, is very clear in her reports, and that there's money which is not accounted for in government. And as such, the fiscus has lost a lot of money through parastatals which have not been functioning for a long time, at the expense of good people who work, who should be paid well. So that's something that you cannot really say is being done fairly, because they deserve to be remunerated. There's a shortage of nurses already in the country before this happens. So they're working overtime. And if somebody's working overtime, pay them for the overtime and for the work that they're putting in. There's no debate there. I think it's as clear as that. And I think government must also be putting together measures in which they ensure that the health sector, which is critical in the country, is well manned, the same way they did with the security sector. You know that we are dealing with inquiry on diamonds. The security sector was given diamonds because of the fact that they are very key in the peace of the country. So should the nurses also be given something for their key in the health sector of the country?
Right. Nigel, there is money, it's just not being properly allocated. You're hearing that from an MP?
Yes, I mean, I agree with it. I agree that, our priorities, and I agree with even what David said, our priorities aren't right. I think, looking ahead, right now we are in the middle of school holidays. Children go back to school. My daughter goes back to school in about 2 weeks. I spoke to a teacher who also said, look, if they don't solve the nurses issue, we are prepared to go on strike as teachers, because there's also been an issue there in that sector. So, look, we're living in interesting times, but and I think the priorities need to be, we need to prioritize. Like I said, education and health are very key sectors in our country, as with any country in the world.
Right. Temba, was the vice president extra confident, and maybe did he gamble a little bit, given that he knew that there were so many unemployed nurses and so many who had taken early retirement, who would have wanted to come back for, I don't know, a little bit of extra pay, and that's why he could play hardball?
Now, listen, to me, it's not about having a lot of unemployed nurses. The issue is to remunerate those nurses who are currently working. Already they're working overtime. And what was important for the vice president to understand is that most of these are legacy issues which were done by the former president, Mugabe. And it was important for him in the new dispensation to say, yes, point taken, the nurses are correct in advocating for the remuneration in this manner. But can they give us time so that we look at it and we respond to the matter quickly? You know, there's an issue of admission. You cannot talk about the new dispensation when you're not able to also talk about the old regime or the old dispensation, which did not do things properly. So the two work together in terms of achieving a futuristic approach for the country. And I think this is what we must be used to in admitting that, yes, things were not done properly, but now they're going to be done properly. Please, we ask you to continue working, but we will be attending to it so that there is clear indication that there's the new dispensation, not to behave as if we're in the old dispensation. It's unacceptable. And I think it is important we take cognizance of the fact that the nurses for a long time have suffered and they cannot keep on suffering. And the new dispensation must not be new in terms of administration, but it must be new in terms of doing things which point out that surely there's a new dispensation. His Excellency, the President, surely has gone around the world and has indicated to the world how Zimbabwe is open for business. And that does not only talk about people coming into Zimbabwe. We must first of all do good for our people. Charity begins at home.
So, Doug Coltart, given that it's been mentioned that it was a legacy issue from the old dispensation, and I think you can all agree that this is a legacy issue from the Mugabe era, do you think that Emerson Mnangagwa has failed the test to prove that the new dispensation is different?
I would have to say that he has. I think that this is what a lot of citizens feared when a large number of military personnel were incorporated into government, that we would see a militarization of our governance practices, and that really seems to be what happened over the last week. That it almost felt like our labor practices were being run like a military barracks. And Chiwenga's decision, Vice President's decision to fire the nurses, the chaos that has been wreaked as a result of that is not entirely done away with government now allowing some of the nurses to come back. I was speaking with nurses this morning. Those who have been allowed to come back are concerned that some have decades of experience. Will those decades of experience still count? Some of the nurses who tried to go back have been denied and told that they will not be accepted back into their jobs. Yeah. So while certainly we're glad that some nurses are being allowed back and that our hospitals are functional again, the confusion and the chaos from such an irrational and undemocratic decision, are still being felt.
Yeah, no, they have to reapply for their jobs. We're hearing, as you say, that a lot of them have been let in. Some of them have not, and they're awaiting readmission into their old jobs on the same terms that they had beforehand. Nigel, I've got a little stat that came last year from the Health Minister, Dr. David Paririanyatwa, who he gave this last year, and it jumped out at me. It said the current nurse staffing complement, about 16,000, was equal to levels in 1980 at independence. And back then the population was, I guess, half of what it is now. What does that tell you, Nigel?
Look, it's a worrying statistic. I'm a numbers guy, so numbers stats are very key for me. But it's a very worrying statistic. As I mentioned, the health sector is very, very crucial in any society. More so here in Zimbabwe. What I worry about while we discuss this is we could be discussing stats and and various other issues, but let's also think about the patients, because last week on Wednesday, a patient was lying on a hospital bed and they weren't being attended to by a nurse. I mean, I wonder where that patient is today. So yeah, those statistics are worrying. We need to invest more in the health sector in this country. I believe the Abuja Declaration speaks about 15% of the national budget needs to go towards the health sector. Here in Zimbabwe, the health sector is heavily subsidized by a lot of donors, and that is not a sustainable situation. We need to increase our own investment as a country in the health sector, and I'm eager to see what happens with the budget this year, after elections.
So as we broaden this out, Temba, besides looking after nurses and ensuring they are motivated to do what they do, such an important job, how would you fix the entire health sector, Temba?
First of all, there's a Abuja Declaration which must be adhered to. I think it's important to know that as Parliament, we certainly recommended that. There was no way we're going to pass the budget without the Abuja Agreement being factored in. It was a very important issue, and parliamentarians were in unison pertaining to this issue. So Parliament did its job ensuring that we're not passing and we're not voting until this is passed. So we're very clear on that, realizing how important the health sector is. And I think what is important too is to realize that from a legislative point of view, we also have a situation where I think the Minister of Health is widely funded by donors, and I think it's a situation which is not sustainable. And I think pay as you earn, which was government biggest revenue, is no longer that because of the unemployment levels which are there. So as a result, the nurses are likely to suffer. But we'd also like the nurses to be treated the same way the military, the police, and others are treated in terms of being given timeously their bonuses and their salaries on time. There is an issue of bonuses which also eats into all this, because this is a culmination of so many problems which have not been dealt with. And this is what happens. As much as I also feel for the patients and for people dying, my appeal to the nurses too is that you've been very nationalistic about this. You've been very patriotic, and you've paid a heavy price. But there's also human life which is there. Should we allow it to go? Because of that, everybody has a conscience at the end of the day. I would want their conscience to be their master. At the same time, government must not allow a situation like this to prevail. That is the reason why there are elections. And now it goes back to the people to decide who they should elect so that they can be a competent Minister of Health and a government which is able to solve problems. The president can only do so much. He has a team around him. And if the team is not working according to expectations of the people from a health point of view, there's not even enough clinics, hospitals. Government has spoken about building 2,000 clinics. I asked the Minister of Health the other day in Parliament, question time, what government had done to achieve that in terms of the policy and manifesto that they had. And no clinics have been built. He could not give a figure. He says, I'll come the figure. So to me, if you're not then even building more clinics, which are critical, because it should be in the radius of 7 kilometers for want of access to a clinic. And it's no longer that, it's 20, 30. So that's not even in line with government policy. So there are a lot of outstanding issues from a health point of view, which really, at the end of the day, they're not attended to. This is what happens at the end of the day. And I think it does not put us in good light as leaders, as a country, and even the nurses themselves again.
Right.
But they're human. They need to eat, they need to pay bills.
Okay. Well, there's a massive wish list for Zimbabweans and a massive list of challenges for this new government. Gentlemen, it's been fascinating talking to all of you. Coltart, Nigel Mugamu and Temba Mliswa. Thanks so much for joining us here on the Newsmakers.